Вот он, Леш, я вас включил. Он яркий сейчас, громкий.
Ну потише делай.
Потише, если просто убавили, поставили на лоб, он будет вот так вот. Ну, когда будет громко, он вылетит. А так он где-то вот таким вот уровнем будет.
Громко не будет.
Вот таким уровнем он будет. Раз, два.
У меня здесь еще свой пульсар есть.
Сделай все как бы. А не получилось.
Слушай, заткнул, а оно только пришло.
Да, это.
Есть такой у него минус.
Ну, это слушай, ты знаешь, что выяснили, почему эти самолеты падали, там какая-то хрень была. У летчиков, у военных, в Су-25 на первой модели. У них эти руды вот эти, да, работали с задержкой тоже. Он тянет раз, а он еще не.
Я слышал эту
он,
историю, да.
он повел туда, он туда, и получается, что он раскачивал самолет
Да.
и уходил в штопор.
Да, я слышал, что он там был.
Вот такая система сейчас себе.
Дима, увидишь, как бы, ладно, обстроили, идет.
Знать было об этом.
Ну, на самом деле, знаешь, что мне еще не нравится? Мне само качество ГШУ не нравится. Почему? Потому что потолочная акустика, она звук не создает, она объем создает.
Она это, какой? Бу-бу-бу. Так, а здесь.
А линию мы загнать не можем. У нас это перевод из Черкасов. Вот там реально будет проходит.
Жень какой-то.
Так, ну ладно, пришел. Блин, зараза, 35. Игорь. Короче, решил я купить проводок.
Проводок?
Да. Вот как ты думаешь, брать канал или брать канал? Это фирма японская, японская. Мы там можем синяя.
Цене?
Да, 150 метров. Один кабель.
А качество?
Два. Тимигрицовый.
Подожди. Сколько стоит? Допустим, 100, ну, 200 метров. Сколько стоит?
Считай, 2 евро.
Ну да. Я думаю, просто канале. Цены не заставил.
Да, потому что смотри еще что нюанс. Вот цены нового, который Андрей купил, вот это вот. Он, не, он там идет. Вот он новый взял кабель, он в принципе неплохой, но он, зараза, поставил на него поставили хреновые конвекторы бензичные, то есть он не туго держится в разъеме. Он же в нем гуляет. Вот поэтому я не могу определить, хороший кабель. Ну, вроде как работает, передает. Там кабель стоит 60 рублей метр. И причем он, в принципе, неплохой.
Смотри, есть тесты на этот самый, можно как кабель протестить. Там же он должен передавать определенную форму сигнала, чтобы он не подал. То есть там идет вот такая
Синусоида, да.
Да, если она приходит не размытая ровно.
Я знаю,
ну,
да. Это тест на затухание сигнала, да, я знаю.
Вот и проверить.
Я
Тут взять кусочек того, хотя это кусочек набрать 100 метров.
100 метров проверить, да. Потому что я тут недавно сидел, читал статьи по технологии, технологии сделали.
Я когда свой померил, то помнишь, что была дохлая двадцатка, что ли, идеальная. Значит, там было 100 метров, приходится, тут чуть-чуть размытенько. На эти 20 вообще. Это не хорошо.
Он,
второй
SD, он
был-
SD-шный, что ли?
СДшный студия.
Нет, ну,
Дырки. Вот я хочу ее порвать на сделать 2 по 10.
а ты смотрел амплитуду, насколько она сильна? Будет она там западать? И надо пометить, чтобы он не спарил с места. Мы же спарем.
Может на короткие вещи?
Ну, не, ну 10 метров это в принципе нормально. Вот 10 метров это
Вот он, вот, пожалуйста, здесь будет работать. 2 куска по 10 делать. Кофе хочу, мы забыли кофе. Я рекламу себе. Я прямо с Нового года, мы поехали мимо, я уже спешил, но я... Я поехал. На корабль.
А?
Раз, два. Раз, два, три, четыре, пять. Раз, два, три, четыре, пять.
Слушай, а на стойке микрофона есть там?
Стойка микрофона есть в Одисе, по-моему, Лёх.
Раз, два, три. Два, три. Раз, два, три. Раз, два, три. Раз, два. Раз, два, три, четыре, пять. Раз, два, три, четыре, пять. Раз, два, три, четыре, пять. Сейчас мик посмотри. Звук подключен. Раз, два, три, четыре, пять. Раз,
Ничего.
два, три, четыре, пять. Посмотри на звучит. Один, два. Раз, два. Здесь есть, отлично.
Вот здесь вроде.
И если там индикация есть, значит он происходит. Значит он не уходит в твою систему. Посмотри, где уровень 32. Не выключены все звуки ноль. Окей. Один, два, три, два, три, два, три.
Тестить. Есть.
Первый канал.
Перешел. Да.
А ты послушай можешь, потому что титул идет, потому что идет.
Сейчас.
Неизвестно.
Сейчас. Нет. Ну давай. Так, давай английский.
Давай, это 6 на английский. Английский канал.
English channels on now. I hope you can read me loud and clear. I hope you can read me loud and clear.
Ну приходит сейчас здесь. Спасибо.
Есть какие-то проблемы, то
Но он такой жеванным приходит. Жеванный.
сейчас, секунду, дай мне когда-то... Газик, давай вот так подальше друг от друга.
А, друг на друга зовут?
Я не знаю. Ну, мог. Давай скажи.
Good morning, ladies and gentlemen. I'm glad to see you all here. Take your seats. Hope you had some rest after
Первый канал
a
теперь.
day.
Второй канал.
Good morning, everyone.
Это не то, что я хотел, сейчас я... Но...
hope that we will manage to have the same exciting day today as we used to have yesterday. So please take your seats. We are waiting for our speakers to join the panel, and we'll start in about 2 minutes. One, two, three, four, five. A B C D E F G H I J K L M N O P Q R S T W Q R S T U V W X Y Z X Y Z. Now I know the alphabet. A B C D E F G H I J K L M N O P Q R S.
Все правильно русские.
актуальные тенденции в сфере регулирования производства лекарственных средств. Панельная дискуссия «Актуальные вопросы производства препаратов крови» будет происходить в зале ОМС.
О, и все, отлично. Левый, правый, да. Вот, картину поправить.
Ladies and gentlemen, we are glad to welcome you all here in the pharmaceutical and legal session, the current tendencies in the field of regulation of drug manufacture. Today we are going to discuss some current topics, and as I see, these topics have the same goal. This is switching to new registration and approval rules and new inspection rules according to the EAU requirements, and all of that is related to switching to the regulation according to the EAU's requirements. So the first speaker will be Anastasia Kalmykova. She is the senior expert of the Administrative Regulation Department, working for the government of the Russian Federation, and she will tell us how the regulatory guillotine will impact the mandatory requirements for drug manufacturers.
Добрый день, уважаемые коллеги.
Good morning, dear colleagues.
Благодарю за возможность
Thank you very much for this opportunity to speak and express my opinion on this vivid topic. And this is a very precious community, and you know the industry from start to the very end. My report will be on the regulatory guillotine, on some general approaches, on the overall documents adopted, and the specifics of the industry. The term regulatory guillotine is stuck in our lives starting from spring of this year. I'm sorry, I cannot see my slides. So first, the president in his address gave a task to systemize the system of mandatory requirements. Then in May, a resolution of the government was adopted stating the roadmap and the mechanisms to implement this regulatory guillotine.
Мероприятий предусмотрено принятие двух федеральных законов.
We are to adopt 2 federal laws aimed at systematization of our regulatory policy. This is law about state control and surveillance and the federal law on mandatory requirements. And the federal law on
Если законом о государственном
So
контроле
the
надзоре муниципальных
federal law on state control and surveillance is very well known to us. We are actively discussing it, some procedural topics, and
те новеллы, которые в нем
industry
то закон об обязательном
is ready to implement all the novel which are there. As for the new law, its draft has been developed and it's now being reviewed by state authorities, and it is to be put into effect very soon. This is the basic law about procedural aspects on how the mandatory requirements should be established, revised, and adopted again. It has a very wide scope, regardless of what you are doing, whether it's pharmaceutical activity, the mining activity, it doesn't matter. So the term regulatory guillotine is very conditional. Based on the mechanisms which are adopted, we are talking about reduction of state control and surveillance by means of narrowing the mandatory requirements for our activity and establishment of very clear goals, establishment of the criteria for update and the criteria for their effectiveness, because the law is based that until 2021 we are to revise all these requirements and leave only those which are indeed necessary for our economic activity. We can see foreign colleagues in the audience, and I think that they are aware about these reforms of our regulatory policy, and you know that there are various reformations, and sometimes it's deregulation. We're talking about Great Britain, when some of the functions are delegated to self-regulation. There are such functions as revising of regulatory procedures when we are talking about not about reduction of regulatory requirements, but ordering the procedures, control procedures, so that they could have a less pressure on business and that they could be aligned with each other, and for us to better know what we should go through before we access the market. Of course, there are mechanisms to align the procedures, and there are mechanisms when the legal acts are compared to each other and the duplications are excluded from them. This is sometimes technical work on verifying the regulatory database. What our regulatory guillotine is peculiar of is that we combine all those mechanisms. This regulatory guillotine does not mean only mandatory requirements. You have 3 directions: the regulatory guillotine in regulatory requirements, regulatory guillotine in state control and surveillance, and the reformation of the administrative code. And all these 3 mechanisms are interrelated with each other, and they should give this positive effect when our business will know what are the rules of the game and how to behave in the market. It's not quite clear to me whether my slides can be on the screen. Yes, here they are.
Я уже, видите, пролистала несколько
I've gone through several slides already.
слайдов. Вот как раз модели регуляторной гильотины. Впрочем, я вам говорила,
Here are the models of regulatory guillotine, and you see that we are talking about simplification of administrative procedures in the European Union. We always justify how effective this or that intervention into regulatory authority is. And as I mentioned, in Great Britain, they reduce the pressure from the state. On I'm a lawyer, but I cannot handle the electronics very well. As we are limited in time, I will tell you about the project, conceptual positions of the draft federal law about mandatory requirements. Starting from January the 1st, we are to start living in a new regulatory environment. I want to tell you that we have active steps towards preparing 2,000 legal acts, and we have drafted them already, and we have processed them to eliminate everything which is not necessary. And these are legal acts for manufacture of pharmaceuticals as well. One of the risks of this regulatory guillotine, talking about zeroing and so these are the legal acts which have been prepared, are the legal acts of the Soviet Union. This is the trivial approach, but we believe that the legal acts of the Soviet Union do not let us perform and conduct our economic activity. And I believe that manufacturers and pharmaceutical companies are here, and can we vote? How many legal acts of the Soviet Union do you apply in your activity? I think that no one will answer yes. But I can tell you that we do have legal acts in this list. For instance, the decree of the Council of Ministers of the Soviet Union on the procedure for manufacture of drugs, and it was effective for the period from 1964 to 1980. Not even a lawyer can tell you that this is the legal act which is limited in time, and it has no effect at all for the time being. But we are wasting our time to include it into the list. And there are some other legal acts, such as order by the Ministry of Health establishing the industry standard on the drug expiry date. It dates back to 1984. Industry standards. We know the reformation of technical regulation, and the topic of standards was resolved then. And the standards have no relation to mandatory requirements. They are voluntary, and even if we do not use this standard, then it's voluntary, and we use standards although they have a voluntary nature. It's not a mandatory act which has to be necessarily applied in drug manufacture. The next conceptual approach of the law, the previous one, please. So the next conceptual approach is prohibition to establish mandatory requirements, except those which are established to achieve targets defined by the law. When do we establish mandatory requirements? What are the goals? To protect life and health of the population, to secure our borders, to protect the interests of disabled persons. So all those rights and values listed in the Constitution of the Russian Federation. Do they give us any requirements and the criteria for inventory listing of our requirements? No. So in this or that way they impact, but there is one more important aspect. When we cancel the requirements, we also have risk of harm. Do all mandatory requirements regulating drug manufacture, drug release, and drug introduction to the market, are they conditioned by the harm, by the risk of harm? Not all of them, because some of them are related to providing normal functioning of the market. Approval of drugs, of course, it has a goal, but before that, drug quality is tested. Before we go for approval, we already have preclinical trials, and we have a confirmation of the fact that our drug complies with certain requirements. And approval has additional functions like registration, tracing, market introduction, and so on and so forth. So this criterion is this tiny criterion, and the risk is inherited in there. One yet more conceptual position is unification of approaches and procedures. They are to be harmonized in the approach to their revision and update, including public consultations, public discussions with involvement of the industry, commerce, and so on. And then we have another risk. The mandatory requirements may differ in content, and the procedure for their implementation will differ in the same way. Talking about drug manufacture, we have the common market of the Eurasian Economic Union, and here, first of all, we are to talk about the order of the supranational regulation, and we have to revise, first of all, not the Soviet Union's legal acts, but those legal acts interrelated with supranational legislation. In the Russian Federation, our legislation has to comply with the requirements established on the level of the Eurasian Economic Union. And it has to be structured in a way that it is possible to implement the obligations assigned by the Eurasian Economic Union within the Russian Federation territory. So this is number one priority. We have to go from up to down. And here I see one more risk. And this risk is that according to this law about mandatory requirements, only laws are to be revised, although the legislation database is not revised. And we have several regulatory authorities involved in the process. Several ministries, Minsельхоз, Ministry of Agriculture, and as it occurs, the approaches to revision of legislation are different among regulatory authorities. So, as for regulatory guillotine in drug circulation, we have to prioritize, and the first priority should be given to the legal acts of the Eurasian Economic Union. Based on that, we have to revise our federal law. Federal law number 61 has to be revised because we have provisions there which do not allow us to implement the requirements of the Union. We've had discussions during the previous 2 days. This is the challenge to be resolved, which we have unified GMP requirements in the EU. How can there be a reference in the law that such requirements should be established by the federal authority? And the cancellation of such provisions will change the situation. And I can give you more examples. I think that this process of regulatory guillotine is not very well thought through, because each sphere requires the specific approach. And here, the cornerstone of the regulatory guillotine should be based on the understanding how our legal database complies with the database of the Eurasian Economic Union. Thank you for your attention.
Anastasia, thank you very much for this informative and elucidating speech. Now I want to ask you how this regulatory guillotine and the mechanism thereof will affect the international obligations taken upon by the Russian Federation as in the form of compliance requirements or requirements in terms of GMP. From what I gathered from your report, it should be the other way around, as our obligations, or international obligations, should prevail according to what is said. Of course, in this federal law on compulsory requirements, there is one article on international treaties and international obligations, which sets forth a general norm also reflected in the Russian constitution. And if an international treaty says otherwise, the norms laid out in a relevant agreement will change, but the field of drug circulation is very dynamic. We have to understand we have a treaty. A few decisions have been taken that have covered, well, about 50% of the we have taken about 50% of all decisions, and about 50% of decision of what we have to have taken for a single market to kick off, we have taken them. But the mechanism of the regulatory guillotine, the way it's being implemented, is geared at the national market, but it should be supranational. In our drug circulation field, we should be guided by the obligations that are part of the EEU, and we should be mindful of harmonization, because one of the requirements not directly covered by the EEU is harmonization, even though harmonization doesn't call for full unification, but still obligations and rules have to be similar, otherwise a single market is not possible. Thank you for your report. Now the Russian Inspectorate in Russia is represented by two structures of the Ministry of Industry and Trade and the FEBO Bilsanpe. So, now, on the subject of organizing a pharmaceutical inspector in the EU, Tatiana Putsila, candidate of sciences, who will tell us about legal issues of pharmaceutical inspectorate. Dear colleagues, good morning. First, going back to what Anastasia said, I would like to say that from my standpoint, from the standpoint of the regulatory guillotine also, we need to understand that this initiative that came along this year, is not a single stage thing, but it's delayed repercussion of the process that started and finished in the early 2000s. Maybe you remember, we were transitioning from the Soviet management model to the new management model. So in place of the ministries and different authorities and structures, three basic structures came around: the federal ministry, the federal services, and the federal agencies. Back then, you have to remember, it was not within a few months or a few weeks, but it was for a few years that a major process was underway, and all those participants involved in this process who, and all the tasks and obligations that came with it, the obligations and tasks of the ministries, which had to be distributed or allocated based, depending on their nature. It could be some were of control nature, it went to the service. If it were it was obligations related to services, it was an agency. If it was of regulatory nature or rulemaking nature, it had to go to the ministries. And we were thinking what duties and powers could have been removed, what could have been outsourced to self-regulation. It was a global process, a major process. Unfortunately, now we want to know what powers and authorities in relation to supervision and control should be excluded, but it's not fully solved yet, and the current practice shows that these three state structures that we had back then, we have moved away from it now on the state level. Now we are witnessing a trend towards going back to the past, where there is a mixing of the functions of different bodies, where services are engaged in rulemaking, and the ministries which were banned from exercising any control are starting to exercise powers of control and supervision, which are not pronounced, but still they are there. From my standpoint, it's not the right thing to do. It's not the right trend. I know it's hard to get to like the perfect result, but still, back then the process was rationalized with logical goals that it pursued. What we have in the field of pharmaceutical inspectorate is also related to what Anastasia said. It's the relation between national and subnational regulation. Of course, there is that treaty that we all know of, which clearly lays out a specific institute, pharmaceutical inspectorate it's called. And I need to draw your attention to the fact that the specific supranational regulations that clearly distinguishes between pharmaceutical inspections as an activity and pharmaceutical inspectorates, or the pharmaceutical inspectorate is some organizational institutional element. In some countries, however, for example in in the Kyrgyz Republic, it is enshrined in legislation. No such distinguishment is enshrined in legislation as of this year, and it's all related to the woes of supranational regulation. It's not limited to Russia, it's also part of the Eurasian Union countries. And if you look at the legislation of the Kyrgyz Republic, you would see that inspection is seen only as an activity. No mention of the inspectorate though, because we cannot gather it from the law as the main act. Inspection has been around for quite a while. It goes way back as an institution. It was present in the Soviet times and the post-Soviet times, but a pharmaceutical inspectorate as a standalone phenomenon is something that came around in the Russian legislation in 2014. Following 2014, some ideas sprouted a little bit earlier, and the legislator was talking about it, but in the 2010s that this institute came around fully. Also, supranational regulation, we need to understand it sits quite general, however, albeit not to be ignored requirements at the level of national legislation with clear definitions of specific decisions that are universally to be enforced. So the resolution of the EEU that extends it to a country is that international act of international law to be abode by, which prevents over not only federal laws or orders, but also but also over federal laws. So it says that the pharmaceutical inspectorate is a structural division of an authorized body or organization in the sphere of pharmaceutical circulation, a member country for performing pharmaceutical inspections. So inspections are derived from the pharmaceutical inspectorate. So it's the activities. And the body is called the inspectorate. So, but it's ambiguous. The EU acts are quite ambiguous as to the place of the pharmaceutical inspectorate in the structure of regulators. Lawyers don't like the term regulator. In the structure of different bodies and regulators related to these activities and to supervision and inspections over it. So it can be a structural division of an authorized body. This inspectorate also it can be a structural division of an authorized organization. Well, the final decision rests with national governments. So the governments, based on their government structure, like the ministries, services, and agencies, have to decide whether this structure, whether it will be a structural division of an authorized body or a structural division of an authorized organization. Anyway, the government has to authorize either a body or an organization to set up a special unit that will be called a pharmaceutical inspectorate.
So this process is very important from a legal point of view because depending on the solution of the state in this sphere, the activity of this company and the situation in the pharmaceutical market will be affected. And this is very important in the sphere of good manufacturing practice. Unfortunately, here we once again have to say that the states which had to be very fast define their position on this topic. So, what are the pharmaceutical inspectorate attributes? They perform pharmaceutical inspections. It's not a legal entity. Here we can argue the position that it's not a legal entity. Why do you have this restriction? Why do you restrict the rights? Because we understand that being a legal entity, the institution has much more opportunities and capabilities other than being a structural subdivision of some authority. And moreover, when we talk about a legal entity, we understand that we have quite a different status the legal status and those who are key personnel of this legal entity. Talking about a structural subdivision of a federal authority, we talk about a department, directorate, some sort of structure, and it is established by a legal act. It can differ, it can vary, but we know that personnel of this structural subdivision should be either civil servants or, uh, in this case, the powers might be outsourced when some other companies are outsourced to perform certain activities. We are talking about the responsibility, of course. One thing is requirements for civil servants. You know the requirements for the pharmaceutical inspectorate. If we talk about a structural subdivision, then plus two pharmaceutical very specific requirements. We need to have the requirements for the civil servant as a standalone term. Otherwise, there will be a mess. So, civil servants representing federal authorities have all the competences according to the legislation. Those who are contracted do not have this range of responsibilities and obligations. Then, there are no requirements to the level of regulation, and it's unclear from the wording what is the structure of the inspectorate. So the unit is a pharmaceutical inspector, but who else should be there in the pharmaceutical inspectorate? Who is considered senior management? Some structural aspects which are less important by others mentioned. It is indeed important that the legal act should be adopted in each state, stating that this or that authority is responsible for pharmaceutical inspections and that according to the EAU's requirements has competencies in this or that. It could be a very short legal act and then powers and rights could be based on that local legal act. Unfortunately, the majority of countries of the Eurasian Economic Union did not adopt such legal acts. Yes, there are legal acts establishing the staff in Kazakhstan. In April this year, the legal act was adopted on how to establish the pharmaceutical inspectorate. This is closer to the model I'm talking about, but you see, 2014, 2015, 2019, and you see that it took Kazakhstan 3 years to adopt this quite simple legal act. Why it is important? It is important to establish the procedure for cooperation of the pharmaceutical inspectorate with other bodies and with other companies, including drug manufacturers. Here, we are based on the fact that we have a variety of regulators and it's not an easy situation for us. In this legal act, it should be established what are the various types of cooperation and what are the legal consequences of such cooperation. Who has the right to give orders, what can be ordered, what do pharmaceutical inspectors do, what is the outcome, and how is this result important for any regulatory authority, why it is important, is it enforceable or is it just for reference. So the prevailing model is recognizing the pharmaceutical inspectorate as the subordinate institution, and here we focus that it should be the Ministry of Health. Then, the Pharmaceutical Inspectorate is quite a novel thing, but its activity is related to quite typical model of regulation when one structure has specific competences. And there are acts in the Eurasian Economic Commission governing the requirements for pharmaceutical inspectors, how they should work, what they should focus on, and of course we reference GMP, which is the book which is always on the table for any pharmaceutical inspector. And in conclusion, I would like to express my hope that the legal acts which are very necessary for our country will be adopted, and they will adopted on the proper level, and they will have a legal nature. There will not be some methodological recommendations or some letters, notifications, because such documents do not have the legal force. And we hope that as an outcome we will achieve the state of unified legislation harmonized with legal acts and other acts of the Eurasian Economic Union member states. And then the second goal of ours is cooperation with structural subdivisions of the member country and clear understanding of who can do what and what are the legal consequences of any solution, of any decision. What will have a legal force, not just a paper, but what legal consequences the document will have. Thank you. Thank you very much. Natalia, I would like to know your opinion, taking into account that all pharmaceutical inspectorates have unified requirements for the quality system, the general requirements for holding pharmaceutical inspections. Do you see that the operation of such pharmaceutical inspectors should be similar, and the work should be similar or unified, and that the consequences of the activity by pharmaceutical inspectorates within all member states should be either similar or, once again, unified? Thank you. Yes, it's an interesting question. It has two parts in it. I believe that definitely legal consequences of the pharmaceutical inspectorate's activity should be similar or at least very close to each other, because otherwise we will not secure implementation of this principle of the union. As for the organizational structure, they may vary. There might be variations, and we already have these variations on the national level, but we see that more and more spheres are becoming harmonized. We have unified requirements for procedures, we have unified requirements for the inspection process, and we can make a conclusion that the requirements for inspectors, not from the point of view of their professional competence, of course, but such requirements are most volatile among all the rest. As for the tendencies, if we reference Europe, where there is complete regulation on the level of the agency, the process is fully national, then our tendency should also be to focus very much on what has happened in every country with the institute, with the pharmaceutical inspectorate during the years. Does the current state correspond with the common goal of recognition and acknowledgement of the results by other countries? And I think that we do have the reason to segregate certain bodies similar to Europe responsible for complete coordination of this activity. Thank you very much for such an informative response. Legal consequences of non-compliance with the GMP will be presented by Alexander Rebialov. He is the PhD in chemistry and he is the professor of the St. Petersburg State University and the director of his own company, Gringo.
Good morning, dear colleagues. Thanks for being with us. So I will try to be short and concise. What I'm going to talk about is what I want to do now is to use a simple example. How that simple example can become complex if you start delving deep into it legally. I'm talking about confirming legal implication for to confirm the compliance of the GMP guidelines for subjects of drug circulation. So I'm going to start out by saying that when a subject of drug circulation sometimes has the need to get this conclusion. And we have two fundamentally different approaches to two different groups of legal entities. On the left, you have Russian legal entities who have more workload because first they need to get the statement when they're at the stage of drug manufacture, but the licensor doesn't have the right to provided but as GMP compliance is necessary according to the licensing clause, a person who gets a license has to get this compliance GMP compliance statement. Then both Russian and foreign legal entities have similar rights as those arise at the stage of drug circulation when the registration dossier content includes the statement on the GMP compliance or the manufacture production license, which presupposes or implies that those rights are there. Legally, the following happens. When a lawyer starts digging deep into a situation, they look at the activities in space-wise and time-wise, and they look at the entities involved. What if there spatially or space-wise, if there is GMP malcompliance, it would appear that the Russian legislation extends only or applies only within the Russian Federation, but I will come to it later. I don't think it is so. Time-wise, there are 3 times which characterize GMP non-compliance. The future, which is a ban for drug circulation, I'm sorry for the grammatical error there. The present time, entailing a ban on drug manufacture within the Russian Federation. And circulation entities also need to be aware of the past because there is a ban to use a drug which is already in circulation, not across the board, but it is something that we have to be mindful of. Pavel will be the next speaker who will dwell on it in detail. the parties involved. Now, Russian legal entities, including expert here, it applies to them in full. GMP compliance is part of licensing requirements and conditions, so if there is non-compliance, it puts the kibosh on the licenses to produce not only within the Russian Federation but also within other countries. And the difference between producing registered drugs for Russia and unregistered drugs for any country, the Russian legislation doesn't prohibit the second part, the latter, but if there is legally non-compliance of GMP, the Russian manufacturer is banned from producing a drug for export also. However, the important country may not mind that drug. Foreign entities, it's more limited. They would lose a part of the market here. They would only lose the Russian market. Now, time-wise and the legal repercussions. So here we can see suspension of drug application, and Pavel will dwell on it once I'm done here. So the yellow circle is more interesting from its failure to comply and how it's recorded, and also marketing authorization ban. What we have now, though, is that we have order N777 from November 17, which introduced a ban on the use of drugs, in one of the cases being GMP non-compliance. And here, this August, we recognized the bad side, or like the ambiguity, not the defectiveness of this ban. I will use one drug as an example, Nurofen. It's a suppositorium for children, so the law from the Minister of Health was introduced to suspend its use, and it was dated August 9, but the ban the application ban was introduced on August the 7th, and it was published on the website of the State Register of State Drugs on August 13. The Constitution of the Russian Federation states that unpublished and posted acts cannot be enforced. Publication is a different thing. It's in a different article because there is order of the Minister of Health which says that publishing something means placing something on the official portal of the legislation of the Russian Federation on this harbinger published by the Minister of Health that no one has heard of, where they publish things. Of course, we have the internet at our disposal, and once there, you can extend to as many parties as possible. It's better than printed products, which will come out in 2 months. What causes apprehension here, legal-wise? There are two things. And now let's talk about court proceedings. So it's a 50-50 thing. Should a subject follow the website of the Minister of Health or Rostovnadzor or something else? It's not part of the licensing requirements, but it's in other orders. It can be found there. So courts may take either side here. The second thing, GMP non-compliance would seem to extend only to the manufacturer. No, it extends to all pharmaceutical companies. It also extends to all medical organizations who know nothing about it. The reason why it is the case is because this application ban extends to all or to a large number of parties, entities that would have to be involved in addressing this situation. And on the first day of this conference, the labeling section said that labeling is a great achievement which would allow us to track leftovers across pharmacies and manufacturers and retailers. But like my example, the ban was introduced on the 7th of August and was published on the 14th of August. So based on that database, the state or body would go out, would start fining pharmacies for selling drugs that should not be drugs. So this labeling is also like something that causes a danger to entities. Ep- the circulation bans here extend to two parts, which I will elucidate now, and this is where I will stop. The consequences or legal implications, I divided them into implications for Russian entities and for foreign entities. The foreign entities would be faced with import bans and legally I would want to know how the customs would be aware of that, how would they put in the loop about this, because now customs bodies are not part of that system where there is information on a ban or application, drug application ban is published, and what is more dangerous is that the ban which extends it to the activities of Russian legal entities, because now that liability is seen in Part 4, Article 13 of the Code of Administrative Misdemeanors. It can be enforced for up to 90 days. It takes some time for it to get to court. It can be suspended temporarily, like a drug. At the same time, GMP compliance basically puts a ban on the licensors' activities without a court ruling even present. So this is how I wanted to communicate to you how this simple issue goes haywire and quite dangerous in terms of legally. And by using this simple example,
So it was announced, so I want Pavel Kabytov to develop this topic. He is a scientific expert of the institute acting under the government of the Russian Federation, and he will tell us what are the administrative enforcement measures in case of incompliance with GMP. Probably I may have some repeated aspects, but I will split my report into two parts. The first one will be an overview, the second one will be analytics. So I will touch upon the enforcement actions in case of incompliance with the GMP within the framework of harmonization of our legislation. So the general requirements include enforcement measures established in the legislation for licensing and the Code of Administrative Punishment. And no changes are expected here because it is within the legislation of the Eurasian Economic Union. All the enforcement actions are executed. I referenced to the practice, and as based on the reports of the Ministry of Industry and Trade, no administrative measures are executed for our manufacturers. As for the specific requirements established by the law on drug circulation, what we have now is suspension of drugs. This may lead to a suspension of the decision on qualification of the qualified person and exclusion of the drug from the list of vital and essential drugs and from the list of drugs to secure certain patients. So what do we have in the Eurasian Economic Union? We have a wide range there. That is the suspension of the marketing authorization, limitation or restriction of the use of the drug product, and cancellation of their marketing authorization. What is the difference? The difference is in the contents and in the legal implications. What we should focus on is that the union's requirements are more closely related to the marketing authorization and the requirements for drug manufacture. And the second thing is that the supranational legislation states that suspension of marketing authorization or suspension of the drug will result in withdrawal of the drug from circulation. Now, some details about suspension of the drug. I am indifferent to this measure myself, but from the viewpoint of legal implication, we have four wrap-up points here. First of all is suspension. We do suspend. First version of Article 65 had one part. Now we have four parts in it, and here we have three different legal actions. First of all, it's suspension of circulation, then suspension of use, and suspension of sales and use. What does it mean? This is a part of the drug life cycle. Who are the subjects of use? Medical institutions, doctors, patients. The law, healthcare law, tells us that it has nothing to do with the use. So what do we suspend then? Do we prohibit people from administering tablets? The answer is found in the order of the Ministry of Health on the rules for shipping, sale, transfer, and the use of drugs. This is where we are referenced to the statement that suspension of the use of a drug means that the drug should be prevented from getting into circulation. So it means that it's not only suspension of use, but it's also suspension of sales. This is the requirement of the federal law, or is it not the requirement of the federal law? As far as I remember, the rights are restricted only by the federal law. So once again, we are talking about the regulatory guillotine and how it all corresponds to each other. Then the second wrapper point here is the content of reasons to suspend. Here we have a certain discussion. First of all, manufacturers may not have documents confirming compliance, but in this case, the drug cannot be put into circulation, introduced into circulation. And it's not clear how can we suspend the use of the drug which cannot even put into circulation. And two more reasons. A medicine manufactured at the site which is not listed in the registration file, or the manufacturing technology is different from that stated in the registration file. Here we have a question. Suspension of use is a very light measure in this case. If more than 30 days have passed since detection of this fact, then it's worth having, it's worth canceling the approval of the drug on the whole. Here we are talking about the cancellation of the approval. And as far as I remember, in the legal act, there is no correct statement, clear statement, what are the reasons for canceling the approval. Then the next point is that suspension of use may be a need of patients. And in the supranational document, we have clear statement when the drug can be suspended from use, and we can suspend the drug from use in the middle of its treatment cycle, and it can have an impact on a patient as well. And the fourth aspect, this is my favorite slide with the plant. The situation is very simple. A long time passes from the date of manufacture till expiration of the shelf life. A GMP certificate can be obtained during this period, and from the date of manufacture to the date of detection of incompliance, the drug was being manufactured according to all the requirements. So is there any need to suspend it at all? Thank you. Thank you, Pavel.
Я бы хотела далее передать
Now, I would like to give the floor, thank you, Pavel. I would like to give the floor to Yelena Popova, Chief Director for Regulatory Issues and Policies in Healthcare, the Association of International Pharmaceutical Manufacturers. So we're going from theory to practice now. Yelena, please. Thank you, Irina. Good morning, colleagues. Now I would like to pick up where the previous speaker left off. It's about suspension from the practical point of view, because this norm does work now, and I would like to remind you that it was adopted in June last year, and what was introduced was measures of additional accountability to manufacturers for ensuring proper manufacturing processes in order to prevent risks, in order to prevent dangerous drugs from going to the market, to protect people, which is an important measure to protect public health, ensure public health. As has been mentioned, however, already, there is two sides to this issue, which imposes major liability on the manufacturers and regulators in making such major decisions. In this regard, I would like to draw your attention to two factors that have been kind of skirted today, mentioned today. We are moving toward the EU space now, with many drugs having been submitted for registration under the EU requirements. So certain regulatory decisions, including those related to drug suspension, still it would affect some other member states and other territories and the healthcare systems of other states. So this decision that I'm talking about now should be given double profound consideration, and it is to be taken in the presence of major risks. On the other hand, you've also touched upon drug labeling, and I'd like to read it out. On August 30, as you may know, the Prime Minister signed modifications to the monitoring provisions related to the movement of drugs, and Provision 7 of 1555 article, the blocking requirements to medicinal drugs, and including information on introducing drugs into circulation, and it also extends to medicinal drug circulation. Point 14 adds the Minister of Healthcare of the Russian Federation has taken a decision to ban a drug in accordance with Article 65 of the federal law on drug circulation, which means that starting from January 2020, when the MTLP system is fully put in place, an order from the Ministry of Healthcare on drug suspension will entail automatic blocks of all batches and series of a drug within the Russian Federation across pharmacies and across hospitals. So hospital institutions. So the gravity of these decisions is something that should be a subject of debate related to how decisions should be made, and there is no doubt that if the system is still to be modified, let's modify it. Going back to Article 65. What are the grounds related to GMP non-compliances identified during inspections? Our colleagues have touched upon that. It's the content and technology of drug manufacture, which would be different from those stated in the registration dossier, or if a drug is produced in a site different from the one specified in the dossier, the manufacturer doesn't have the document which would confirm the requirements to the state registration ones, and in the registration dossier, another important point is that the manufacturers have to, within the agreed period, or they have not rectified GMP deficiencies or licensing deficiencies within the agreed period. And these 4 points, which is the most important thing, as is stated by the law, suspension matters should be taken up for consideration by authorized bodies within an established order related to consideration of the grounds for suspension, and these grounds should either result in a suspension through establishing the episode, or it could be related to drugs which could harm or are liable to which have harmed or are liable to harm the lives and health of citizens, which qualifies as critical under the order of the Minister of Industry and Commerce. So the federal law defines 3 key criteria to be considered in combination. It's the criticality of identified incompliances, their impact on life and health, which have taken place, or potential ones, which are real grave, also specific for reasons which are not critical, but there is 4 of them, and an order for taking such decisions has to be established. How do we take such decisions? We have seen the first practice of how it can be used in law, much like our colleague said in August this year. 2 pools of relevant orders were published. The first extended to the suspension of 9 drugs, and the second on suspension of 4 drugs. According to the order of the Minister of Healthcare, that has not been publicly assessed in terms of its regulatory force. 3 days following the day when information comes from the Minister of Industry and Trade on suspension or use suspension, the Minister of Healthcare has to inform the holder on the forthcoming suspension in the office. And a few days ago, the Minister of Healthcare came up with a specific article in the personal accounts of applicants, and within 3 days the information has to be checked against the 7 points here, whether the trade name is compliant with the information in the state register, the drug form, the dosage, and the number of registration certificate. So those are the grounds for suspension, these 4 points that I just mentioned. So the form uh, confirmed by Order 777N, which includes the form that is filed by the Minister of Interstate Trade to the Minister of Healthcare, contains these 3 grounds. And if you compare these ones with the State Register of Drugs, the Ministry of Healthcare shall decide on drug use suspension. Now, whether there is an established legal order for that, well, it's a gray area because shape-wise, maybe content-wise, I don't think so. But it's a major issue for the healthcare system, is it not? So, what we're missing out on in terms of regulation is this. It's an additional expert if you look at 777N, that order in relation to a similar procedure related to assessing the safety of drugs, because Article 605 contains a number of other provisions related to pharmacosupervision functions. However, if an authorized body, Rostov-Nadzor in this case, identifies the cases on the market, or there is information coming in from other authorized bodies saying that there is a risk associated with the use of a drug and safety, the Rostov-Nadzor shall prepare motivated information letter which is sent to the Minister of Healthcare, which sends this information to Profile is SMP institution which does an additional examination assessing the risk, reassessing the risk and usefulness of a drug, and based on that a conclusion is arrived at whether this drug can remain in circulation or not on the market, and based on that conclusion the Minister of Healthcare decides on whether to suspend the drug from the point of view of safety of this drug. Of course, as for issues related to non-compliance, of course, there has to be some comprehensive assessment of all risks that could trigger such a decision for the healthcare system. The procedure is not envisaged in that order for now, unfortunately. Another important thing mentioned by our colleagues is that that order doesn't contain any mechanism for renewing the use of a drug, or mechanisms related to some recommendations which can be come up with patient subjects and healthcare specialists, those who are taking the drug. No specific suspension date or mechanism to appeal against that decision, or how to consider that decision, how to deliberate on that. So how is this issue regulated in the US? EU has started their experience as part of through the inspection guidelines, because within the European Union a large number of countries are involved interrelated processes, and we're facing that too soon, because a decision taken in one country will impact the other countries involved. So when you are taking a decision, it should be based on the risk assessment system. First and foremost, however, what should be assessed is the measures taken by the manufacturer to rectify deviations and deficiencies, and whether they're sufficient to deal with the risks. Also, what is assessed is the history of drug circulation on the market, the risks of suspension of drug imports, and absence of similar treatment methods on the market. And what I also want to say, that according to the EU legislation, each competent body should have an internal procedure to consider reports and to draw up reports on GMP non-compliance, and a special procedure to assess risks by inspectorates, and to assess the general risk of drug circulation on the market. So that conclusion or statement should be attached to the GMP non-compliance statement, and the relevant forum has been approved by the competent authorities in the European Union. All these procedures, of course, have to be governed and regulated by a special quality authority of a relevant inspectorate.
What should we focus on? What do we have? We have the implemented in the market and the effective procedure of suspension, but the important parts for decision making are missing. So in these 2 days we discussed a lot that the CAPA procedure should be improved, and manufacturers should have an opportunity to perform CAPA and submit the information about implemented CAPA, and this provision is available in the European regulation, and it should be adopted in the relevant regulations in the Russian Federation. And as we believe there is no system for non-compliance risk assessment, there is no system for monitoring of measures aimed at prevention of risks. Even with the very first procedures of suspension, we saw that suspension of the products with positive inspections took place. Even though there was a positive decision, the product was still suspended. It's obvious that there are gaps in the system for monitoring the system information. What are our recommendations on development of regulation in terms of this? Obviously, as I've mentioned, first of all, it is the topic of CAPA regulation to be implemented in the national regulation. We need the procedure to assess the risks of criticality of non-compliances identified. And implementation of the procedures to conduct complex evaluation of the overall risk for the quality and safety of drugs. Development of the algorithm for decision making. My colleagues mentioned the topic that suspension of use means suspension of sales. But today we have Law 182 on protection of consumers' rights, and it says that a legal entity or a manufacturer has to take all measures aimed at prevention of risk. So actually, even within current legislation, we are talking about the fact that those products which are to be suspended, they are to be under quarantine and have this status until a decision is made to continue circulation. What it means for a medical institution is that it's very unlikely that the product will remain in the medical institution. The product will be very likely returned following the supply chain. Well, when having the labeling law effective, we'll have this procedure implemented. And of course we need a very robust approach to interdepartmental cooperation. And according to the structure which we have now, we see that there should be some sort of interdepartmental commission or any other format where all the parties are involved, and that the decision could be made with involvement of all the stakeholders. And of course we need to update and revise law order number 777. Thank you. Thank you for your report, Elena. We do not have much time, and unfortunately I will have to ask next speakers to have the reports fitting into 5 minutes. And I'll give the floor to Natalia Petigorskaya, who is the head of the Industrial Pharmacy Department of the Sechenus University. When will we qualify qualified persons according to the union's requirements, and what should we do for that? Good morning, colleagues. Once again about qualified persons.
Соглашение о единых принципах и правилах
So,
обращения лекарственных средств в статье 9
on the
предусмотрено
certification
обязательное наличие
of
аттестованного
procedure of qualified persons of pharmaceutical manufacturers, it's mandatory to have a qualified person. In case of non-fulfillment of duties, this qualified person is to be punished according to the criminal law or to the administrative law, following the legislation of member states. Besides, we have some regulatory requirements in part of establishing compliance concerning availability and functionality of qualified persons. Talking seriously, the train called the product life cycle will not leave without a qualified person and will not move without a qualified person. Starting from November the 29th, a qualified person is responsible for releasing the drug, and unless this qualified person has no rights to release, then all our efforts on development, research, manufacture of a drug product will be useless. Due to this, I want to emphasize that unfortunately the federal law number 61 is still not put into effect. It is important in part of the requirements for a qualified person of the pharmaceutical manufacturer. It is an employee certified by an authorized federal agency in accordance with the law of the Eurasian Economic Union. The draft has been available during 1 year. Unfortunately, it hasn't been adopted yet. So, revision of some sub-legal acts and qualification procedure will be useless unless we have this statement that it is necessary to certify the qualified person according to the Eurasian Economic Union's requirements. You know very well the EEC Council decision number 73, where on one hand the requirements become less stringent, the working experience is reduced to 3 years, education scope is expanded for the qualified person. Additionally, for radiopharmaceutical manufacturers or medical gases manufacturers, additional education scope is acceptable. Starting from January the 1st, 2019, according to all the EEC's resolution, we have this requirement for QP availability implemented. And these are the education scopes which allow the qualified person to conduct the activities. But it has not yet been adopted in the Russian Federation because the amendments to the federal law number 61 have not yet been put into effect. In particular, that a qualified person has to be certified according to the union's requirements. Sooner or later, this will happen, and in our opinion, it could happen in spring or summer next year. You all remember very well that the system of certification has been prolonged to the end of 2020. And starting from January the 1st, 2021, all qualified persons will need to have this set of education and modules, unless they are people with pharmaceutical education, unless they are pharmacists.
Что же сегодня у нас происходит?
So,
Происходит у нас
what do we have today?
коллапс.
We have a collapse.
Связанный с тем, что в настоящее время
It's
специальности в Российской Федерации
a collapse because the modules are now grouped in the classifier of professions which date back to 2014, and similar modules are grouped,
специальностей и направлений
and the majors are grouped,
всевозможными приказами Минобрнауки и
and these groups are established by the Ministry of Education and Science. And the acts identify how previously existing groups are transferred to new groups. The Ministry of Education and Science confirms that the main part of the knowledge and skills of graduates comply and correspond with the major, with the specialty. You see the blue example and the green example in the screen. The module used to be called Recycling Technology of Industrial Secondary Materials, then Energy and Resource Saving Processes in Chemical Technology, Petrochemistry and Biotechnology, and now it's Chemical Technology. The same example in terms of a different major. According to the data and the letter from the Ministry of Education and Science dated 2014, all the orders adopted by the ministry confirm similarity of the majors, and they're saying that the basic knowledge and skills obtained by people according to previously identified specialties correspond with this grouping. And I gave you an example of the chemical technology. And at the bottom of the page you see that the field of professional activity of graduates who have mastered the programs include the following technologies: manufacturing technologies used for manufacture of different goods. And here we see different organic and non-organic synthesis and drugs. What we see today is that experts attested in 2014 by the order of the Ministry of Healthcare, and they were deemed compliant with the law in terms of education and experience. When they are re-certified this year, they fail to be certified and they refused to be re-certified. For instance, an expert having two higher educations, the first education got in 2001 and chemical technology of silicate materials, and it falls under compliance of all the requirements of the Ministry of Education and Science for chemical technology. And the second education of this expert is chemical technology with a profile industrial technology of drugs. And this expert was certified in 2014. He or she has 14 years of working experience, but this year this person failed to be certified because the second education was got in 2017, and the Ministry of Healthcare starts counting the working experience from 2017 without taking into account the previous working experience. The second example is of a person having the first education in chemical technology in silicate materials and the second education with the master's and it was agreed with all the stakeholders such as the Ministry of Industry and Trade and the Ministry of Healthcare.
Регулятора в том, что это
It's very difficult to
ввели эту новую специальность. И что же сегодня получается? Мы ее ввели.
introduce a new specialty, and what we have now, people are trained on this specialty, but again, they do not comply. But it was introduced in 2016, people are trained on it, and we follow the logic of the Ministry of Health. Then 5 years after graduation is the requirement they do not fulfill.
И сегодня у нас таких специалистов очень много.
And we have many people who were refused recertification. They were certified in 2014, they were certified in 2015, but this year they cannot be certified and they are deemed non-compliant with the requirements. Then, yet one more example of food biotechnology as the education of one of the qualified persons. The area of activity is the same operation and quality assurance and biotech manufacture, organization of quality control of intermediates and finished products. So having all that training on biotechnology, and again this person is refused. And the last example is manufacturer of radiopharmaceuticals. The education of a qualified person is for radio energy, and it was specifically adopted for radiopharmaceutical and nuclear medicine, and it happens so that such qualified persons cannot be deemed qualified persons for radiopharmaceutical manufacturer, although there is a special university preparing people for such jobs. What are our proposals for optimizing the certification procedure of qualified persons? We need to revise the order number 811, and during 1 year we had no news on its revision. Moreover, we had to revise the order number 61. We have to identify the types of activity, manufacturing activity, and the need and the feasibility of additional certification of QPs when changing the types of activity. This is under discussion at the moment. Establishing an inclusive list of specialties and areas of training that will be unambiguously recognized by the Ministry of Health according to the orders of the Ministry of Education and Science and according to the effective requirements of the Eurasian Economic Union. Establishing the procedure for informing the Certification Commission in case of changing the place of work and position of the certified qualified person. What we have now is that you are writing letters to the Ministry of Health. They're saying that they do not maintain the register, so they will not going to update the register. And you are unclear in this position whether you can change the work and the position, and it's nowhere that you can confirm that you changed your work. Harmonizing the requirements for the information provided by the applicant for certification with the requirements contained in the Council decision number 74. It is the register uploaded now at the portal of the Eurasian Economic Union, and it is in non-correspondence with the Council decision number 74. One more important point is that we call for modifying the terms and definitions in GMP. In Annex 2 and 14, we have the term responsible person. I believe it's worth calling it qualified person. It's our proposal once again. We want to draw attention of the Commission to the fact that the existing portal, the existing website, as the Unified Register of QPs does not meet the requirements of the Council Decision number 74 at all, and the data contained in there violate the requirements, open and closed requirements of the Council Decision. And then we need to develop a verification procedure to check higher or additional education received by a certified qualified person in case this qualified person moves from one state to the other state, whether this education will be recognized, and this procedure has to be agreed on. Establishing the necessary volume of courses, disciplines, modules required by the EAU legislation for evaluating applicants and possible mutual recognition of training, education and certification. You're aware that the educational system in our countries may differ, and here we need some conversion to make decisions on whether we can recognize the person who received education in a different state, and if there is a wish to move to another state, for instance, to the Russian Federation. And what we are missing is the set of requirements for QP and the position of QP, so that this person should not combine any other functions with the functions of the qualified person.
Thank you very much. We have just a few minutes remaining to wrap up our session. Pavel Sukhalinsky, chief lawyer of the lawyers firm Fedoboginsky, Afanasyev and Partners, to tell us about how to protect generic rights during registration in the Russian Federation and the EEE. I will try to be short. I wanted to tell you about a lot of things, but we are running out of time, so I will try to elucidate the most important and critical aspects of it now. I'm going to tell you about this problem brought up by the industry years ago, has been elucidated recently. This problem was brought up by the industry a few years ago and has gained a hearing. The problem is that we have a misalignment between the legislation of drug registration for medicinal use and intellectual property registration rights. It's a comprehensive problem, a multifaceted one. It leads to registration being accessible to generic drugs which use intellectual property deliverables and patents held by other entities. However, on the other hand, we can see abuse on the part of patent holders who are going all out to green like active patents, preventing manufacturers who act in good faith from extending their line and producing correct drugs. So some arguable measures have been offered, like this mandatory licensing, and the court practice shows that it is not enough. We have heard about these recent cases, of course. Point 32 or Article 32 of Law 61 can allows it to cancel the registration dossier only if there is a court ruling. It takes a few years because you have to go through all the courts and you have to appeal, so it doesn't solve the problem really. Now, what has been offered through discussions on several platforms and including the roundtable that happened at the Institute of Law and Law Null Studies and other platforms. This topic has been expanded upon. If you're interested in that, please pay attention to that. Last week, on the portal Regulation Gov public discussions of the law introduced by the Minister of Health finished, came to a close. So now it is taking that legal shape, that subject. So law to on introduction on amendments to law 61 and a few more amendments have been offered, or like a full adequate checking of third-party intellectual rights in case of registration of pharmaceutical drug, introducing system of delayed commercial distribution of pharmaceutical drug, developing an administrative procedure for intellectual right holder to challenge violations committed when a pharmaceutical drug is presented. It's being discussed. I hope it will be part of the final law. And also we need to reinforce control by patent authorities in case of extension of patents by the intellectual practices used in pharmaceutical drugs. I will be short now. National legislation, EU legislation, don't give us a full procedure to check the rights of third parties in terms of registration activities, in terms of the drugs they register. There are requirements which say that applicants need to say whether they hold or don't hold such rights in the application, but no liability is foreseen, so no such instructions are present, so a public and available information system has been offered, and it has been named differently because it's still under discussions. So a register of pharmacologically active substances should be developed, and this register, as we hope, will be introduced in the Russian Federation and kept by the Rospatent and Ministry of Health. By using this system, we'll be able to check information given by applicants when they're applying for registration of a drug. So the problem is that we needed to avoid additional administrative burden on the part of the minister from the Minister of Health, because it's said that intellectual property rights are not within the purview of the Minister of Health. During discussions, I think we reached a good compromise between the Rospatent and the Minister of Health, and how we want this register to be easy to use, publicly available, not to interested parties, not only to Minister of Health specialists. Can use the MNN number to find patents associated with this number and make use of this information later. Also, liabilities must be established for applicants when they provide incomplete data when they're submitting their registration dossier. If it affects the rights of third parties, delayed commercial distribution of pharmaceutical drug is another system. So if an applicant, when applying, shows that in their drug that they want to register, there is deliverables of intellectual activities patented by third parties, they need to specify whether they would agree to the registration dossier being enforced on the date following the date of the expiration of the patent results of that third party. So now when you are applying, an applicant can determine and know that their registration dossier is to the circulation of a drug that extends to third-party patents, so will take some time, not when the registration dossier is issued. The reason why it's important is because in this case the applicant will get the registration certificate and start preparations for the manufacturer to manufacture the drug. And now it's been discussed what powers applicants they will have. So it will be like the delayed commercial certificate, and up until the point when the drug can go into circulation. What powers will they have? So now the common wisdom is that applicants will be given the right to prepare, make all preparations for manufacture, to buy the necessary equipment, fine-tune all the process, get the necessary certificates and permits, and when the patent protection of the third party expires, they will be able to put into circulation their drug on the next day. However, there are cases when such applicants are able to work out an agreement with a patent holder, come to an agreement, or exotically they can go to arbitration or otherwise. I won't go through this, just a few slides. So I just told you that extrajudicially this system is not effective. So there are ardent discussions to include an administrative procedure into that draft law that will not replace the judicial procedure.
But it will allow patent holders to more rapidly resolve the issues of protecting their rights when registering drugs. So when applying, an employee of the Ministry of Healthcare makes a mistake looking at a different field, for instance, and if it was registered in the patent in the correct way by the applicant, then our position is that you do not need to go to the court. You should have a chance to apply to the regulatory authority, and this authority can say that yes, we were wrong, and introduce the corrections. Unfortunately, now the initiative was not supported by the Ministry of Health, but we hope that we can bring the importance of this to the ministry, because this way they can avoid the noise in the media, and they can collect the information on how the work on the intellectual rights protection is conducted. As I mentioned, this is a complex problem, and this problem is not only about the unconscious applicants who try to use others' intellectual property. Sometimes it happens that with minor revisions in the patent, the applicant tries to prolong its validity. So our suggestion here is to set stricter requirements for patent authorities to decide on extension of patents. And it should only be possible if the invention increases the therapeutic efficiency or greatly improves the risk-benefit ratio. Thank you. I wish I could speak more, but I have limited time, unfortunately. Thank you very much, dear speakers, for these interesting topics we managed to discuss today. We are about to finalize our session, and I wish everyone fruitful work. try to be seated. Thank you very much. So, good afternoon, colleagues. We are about to have our final session of the conference. As I see that many of you have flights, have early transfers, so we'll somehow revise the order of the speeches. Solnechnogorsk is a wonderful city. We like it very much, but I believe that everyone wants to go home. Good afternoon, colleagues. I've just received a short message that today is a day of a pharmacist, so my congratulations on that. Let me have the following structure of the session. Those who have flights, who have transfers orders will speak first, and we'll start with the 3 topics announced, and then we'll answer all the questions. We already have a list of questions which will follow as soon as our speakers finish their reports. First of all, we'd like to start with regulatory requirements of prevention of cross-contamination and expectations of inspectors. I will ask Yegor Rybakov to speak, and I will ask Maram Derek. Igor, please, very briefly, so that our colleague from Egypt also had a chance to speak. Hello, colleagues. I will provide you with some theses, and I took some effective provisions from the requirements of good manufacturing practice. Currently in the Russian Federation, the main regulation is order number 916, and within the Eurasian Economic Union is order number 77. All the requirements in these documents do not contradict each other, and in order number 77 they have been expanded. It's not the order but resolution, yeah. So currently inspections against GMP are conducted according to these 2 documents. The requirements for cross-contamination are given in Chapter 5. First of all, it's manufacturing dedicated areas. Types of products to be manufactured in dedicated areas will be listed later on. Then manufacturing campaigns followed by appropriate cleaning. Appropriate cleaning means execution of proper cleaning validation. Then an approach to the design of a treatment and conditioning system. Proper filters for various cleanliness grades and control over pressure differential, and application of cleaning methods with the known effectiveness. It does not only concern manufacturing campaigns but manufacture of individual batches. Here we also expect cleaning validation with established criteria for carryover, and we also expect validated analytical methods for determination of this residual carryover. According to the union's requirements on prevention of cross-contamination, it is necessary to use the risk-based approach. The result of the quality risk management should be the identified measures on prevention of cross-contamination. In the resolution number 77, we have a list of measures suggested, and all these measures are listed in Chapter 5 paragraph 521. Now, a couple of words about the products to be manufactured in dedicated areas. According to order number 916, first of all, products containing penicillins of beta-lactams should be manufactured in dedicated areas. Then, leave vaccines, bioproducts, and cytotoxic products should also be manufactured in dedicated areas. According to decision number 77, the decision to have dedicated areas for manufacture should be based on risk analysis. Products should be manufactured in dedicated areas when it is impossible to calculate the carryover and later on have the toxicological assessment. And when the toxicological assessment is not available, products should also be manufactured in dedicated areas. This is it. I was very brief, so thank you very much. Thank you. Yes, you managed to be super brief. The only reason for justifying such I was being brief. So cross-contamination is very important, and very important is select the worst case. When selecting the worst case, you have to be professional and involve toxicologists in this exercise. And you have to work together with pharmacologists and have the scientific input. We were in a hurry because Dr. Maram Darag has to leave and she has a car already here, but we really want to listen to the opinion of our colleagues from Egypt, so please, Maram. Добрый день.
common general wash area that will be present in the production area, specific measures for waste handling and contaminate drinking water, clean equipment and containers should be appropriate stores and protect from accumulation of dust. For personnel, we have to keep in protective clothing inside the area, while the products with special risk of cross-contamination are an appropriate change interval for clothing. Training should be carried out on regular basis to make the personnel aware of consequence of the cross-contamination. Also, outside pockets are a potential source of cross-contamination, and the transfer of dust due to personal movement should be minimized by cleaning rooms and controlling. For the equipment, using cross system for processing and material and product transfer between the equipment, and education of equipment and education of product contact all. Also use of equipment designed for easy to be cleaned. For manufacturing of critical products, cross-contamination should be prevented for all products by appropriate design and operation of manufacturing facilities. To prevent the cross-contamination, we have to make such a quality risk assessment study should be used to assess and control the risk of contamination. Depending on the level of the risk, it may be necessary to dedicate the premises and equipment for manufacturing operation to control the risk of cross-contamination. We have also for prevent cross-contamination, label dedicated line are required, especially for hazardous products, and the risk can be adequate control by operational or technical measure. And one of the measures to prevent cross-contamination should be checked periodically according to the set of procedures. Here's some of units which are mainly displacement of dirty air concerning to prevent the cross-contamination. Also, if we have ventilation system with 100% fresh air, this is a result for air handling unit. And also this is ventilation for recirculating of the air. And this is the air handling unit, and there are pressure cascading, especially for the in the soil area because it is dusty area. So that's why we have sometimes to maintain such an area between the main corridor and the production rooms. And this is the status label to indicate the status of every equipment, whether it is clean, sanitized, or unclean. Thank you.
Colleagues, you were so brief in presenting a very complex topic. Honestly, to use everything what has been just presented, you need to spend some time and resources. And we want Tatiana to comment on how she manages to implement all of this at the facilities within her group of companies. Thank you very much. Colleagues, good afternoon. I would like to start with the word of appreciation.
Well, it's the fourth GMP conference that I'm taking part in, and the interest in this event, the status of this event, the conspicuous professionalism of the lecturers, and your interest, because we didn't really expect so many people to come here, because some of you have left, but still we have a full room of people who are motivated, who are interested in GMP practices in GMP related issues, and it's the merit of the Shizakov Vladimir Nikolaevich and the Institute of Good Practices. The organizers have been working hard to prepare this event behind the curtain, so to say, and I think that it's been a success. Natalia, thank you too. Let's have a round of applause. They told me It's only 3 minutes that I have. I will try to make it 4 minutes. Colleagues, I have tried to show information in my presentation that could be used for reference, so that you can use directly in some of your matters when you are dealing with the question of how do we manage toxicological, pharmacological properties at an enterprise, without which you cannot choose the worst case scenario for the production that you all have already in place, and B, if you're looking to solve issues related to aligning new products with the production facilities that you have, if you want to produce new drugs on old facilities. We started to think about in 2016 because it's a complicated, complex issue which calls for standardizations of approaches and methods and harmonization of requirements, including European ones, because European partners, when they are joining us in partnership programs, their condition is that their requirements be met. At the same time, that has to be harmonized with Russian requirements and legislation. So we decided to come up with, set up a group of GMP toxicology process or GMP process toxicology, and we set it up. Also, there is a lot of documents which need to be recorded, like MSGS files on substance security. All of them have to be stored. The goals that we were pursuing, not only standardizations of methods and approaches to pharmacological and toxicological substances, but also OALPT and OEB calculations, setting them against Russian documents and norms, and also those reports that we received from foreign partners systematically. What we did, we recalculated information for them using the European methods. Here we hit a wall. We met with a lot of difficulties in situations where the right decisions were hard to make, or it was hard to find the right solutions in our calculations. So we came up with a number of documents, which you can see in this slide. Now, on the approaches approaches to determination of hazard class for active substances and determination of toxicity. The overall scheme for toxic substances handling is that you have to identify the hazard class. At this stage, you are using either the European approach to identify the criteria or just the maximum working zone, maximum concentration. At the next stage, you have knowing that you know the hazard class, or sorry, the class of your substance, you have to understand how to manage your production properly, how to clean it under the established hazard class. Only a proper working group, including interested or involved departments, will identify the risks right. The first thing you have to do is to identify the risk. Then you have to measure quantitatively these risks. They have to understand whether they are critical or not, and they have to try to learn to manage them, A, to exclude them, B, to mitigate them. So a plan of quality management risk has to be hatched by you. At the next stage, you have to decide how to devise purification methods and keep them within the safe limits, how it can be confirmed and verified documentally within the necessary macro level. Speaking about specific approaches in terms of legal acts, I want to mention this European document. You all know it's
You know the European approach. It is based on the EMA guideline on setting health-based exposure limits, and we have translated it, and now we have it in the basis of our Russian approach. And of course, the OEB and OAL limits should be taken into account. The Russian approach is based on the current state standard. Here we're talking about the maximum allowable concentration. Below you see the table, and you see the definitions of which are the substances and what are the hazard class for such substances. In the next slide, we see the approach to defining the hazard class for active substances based on the European approach. Pay attention to this table. You see the class of hazard, OAB. And you see column 4, A, B, C, D, E. So for each group, there is a recommendation on how to handle the substance. If it is group A, then general GMP requirements apply. If it's group B, then you have to secure local exhaust ventilation, exhaust hoods. If it's C, then it's practically self-contained treatment, restrictive airflow, containers for dedicated containers for the product, safety containers for HEPA filters. For group D, we need self-contained systems, closed systems of process equipment, and for group E, it is recommended to organize automated and robotized manufacture, absence of manual operations, and human interference. Then I would like to focus on the difficulties in calculation. I will not reference the definition. You can have a look yourself in my presentation. So, the difficult thing is when you start analyzing the documents you are provided, or when you start referencing the international or big pharma papers. Here you have to understand that your task as an expert is to have a proper choice. You have to account for a proper population, animal population, the duration of the study, and if a mistake is made somewhere on the way, then you have a huge error in measurement, and then the choice of whether to combine manufacture or not will be difficult for you. You have to provide an overview of all scientific data, and the reference document should be an authentic one, and the basic study should use and account for toxicity of all effects. Talking about other parameters, if OAB is determined by a person having insufficient competence, then an error, a mistake, can be large, and here we need to make a proper GMP decision. For this purpose, we have a working group involving people from medical department, and they are responsible for making the decision and brainstorming. And sometimes we have quite disputable topics with a partner because we do not agree on something. Metronidazole, for instance, has been in the market for years. Its toxicity has not been determined just like this. If we start calculating and we have insufficient data for this, and we consider it as the worst case, it might not be the best representative example, but I just want to demonstrate the importance for the person to be professional, to be able to make a decision on every step. A couple of words about Markov calculation and some toxicology-related nuances of this calculation. Markov is calculated through PD, through therapeutic dose, and through ppm. As for therapeutic dose, for some groups of products, such as oncology drugs, therapeutic doses are often set at high levels, from 400 to 2000 milligrams, whereas their negative impact on the human body begins from several micrograms. For neuroleptics, therapeutic doses are often set at low levels, about 1 milligram, whereas the severity of effects is significantly lower than for many other groups of medicinal products. The calculation is that calculation objectivity directly depends on the group of medical products. As for ppm, the APIC guidance recommends to set the range from 5 to 500. For non-toxic products, it is recommended to set the value of 100 ppm, and the selected ppm value should be supported by scientific evidence. The question is, how many ppm do we use when we calculate the worst case? 10, exactly. So the method calculation for ppm raises concern. There are contradictions between documents and even inside one document. For non-toxic or highly toxic products, accuracy is low since such as an approach is average. Conclusion is that lack of uniformity, subjective approach, low accuracy. It's also possible to calculate Markov from PDE. Please get yourself familiarized with all the definitions and please read what are the main possible mistakes. I would like to focus on qualification of personnel. If a company wants to establish a similar group of experts, a working group, it's a problem, it's a challenge to find professionals for this. We have a person who has a PhD in toxicology, and she is a member of our group. We have looked at currently running courses for toxicologists in Europe and Russia, and you have references to some of the courses here in this slide. There is a Medical University of Innovations and Development, and the program is Qualification Upgrade Program in Toxicology. They have a program of certification of qualified person for the topic of toxicology or toxicological chemistry. But if you go inside the course, it has nothing to do with the toxicology. So the majority of courses are not related to pharmaceutical industry, or they lack superficial study of procedures in case there might be shared manufacture of products, total absence or minimal amount of cases for their evaluation in the view of PDE or OEL calculation. So if a non-professional performs the assessment, then it may result in some implications for the manufacturer, negative implications, and a manufacturer can have a question whether to develop or not develop manufacture of certain drugs. So we are based on a subjective approach and rely on the competence of personnel working in our companies. And the main question is to share or not to share. In the Russian Federation as well as in the European Union, currently no requirements exist towards training, qualification, certification of toxicologists for pharmaceutical manufacture, who then would be able to perform expert evaluation of challenging borderline situations and make a competent decision about shared dedicated facilities to be used in the production of medicinal products. It doesn't mean that in Europe they have better competence, it's just different. In Europe, to evaluate a professional toxicologist, there is a work group. And once again, we have a question, who are those people evaluating? Working experience and scientific publications are reviewed, and then it is a decision is made whether a professional is ready to conduct toxicological assessment. So subjectivity is obvious here. Of course, we lack information on toxicological data, especially for generics, and we do not have the rates for calculations, and sometimes it is the reason why a manufacturer cannot make a proper decision. The only possible decision here is to not allow shared manufacture. There should be regulatory standards which are unambiguous and explicit. Yelena answered this question. If you are not sure, don't run ahead. You can share manufacture of the products which are obvious. If you doubt, if you have any doubts, then you have to prove it and have a justification that you can share the manufacturing facilities. So our colleagues told us which measures could be taken to avoid contamination. While the manufacturer says, okay, no cross-contamination because you should not share the manufacturing facilities. Well, the manufacturer is the best to know. Now let's switch to the next session, the peculiarities of GMP requirements for API manufacture. Vyacheslav Gorechkin, please. Hello, colleagues. I was said that I have just 1 minute, so my speech will take 2 minutes. Once again, I want to emphasize the importance of this topic because it's the third day of the conference, and every time we once again return to this topic of what are the requirements for manufacture of API. We are talking about sterile APIs in particular, and aseptically processed APIs. Here, I want to see why we focus on the requirements so much and why this topic is very important for us. It has no sense to discuss why the drugs are so important and why this is so important. So, a couple of words about terms. What is the pharmaceutical substance? It is a substance containing 1 or 2 ingredients having a certain pharmacological activity, and it is regardless of the nature of their origin, and they define the effectiveness of the drug. We all know that our order number 916 on GMP and the resolution of the Eurasian Economic Union on GMP contain chapter 2 dedicated to manufacture of APIs, and here I want to say that oh yes, and don't forget about international guidelines, ICHQ 7, detailing the requirements for API manufacture, and I know that at this conference, this topic was discussed in detail already. And we are talking about the complex process, especially aseptic processing. I was present at this session where we discussed how many filters should be installed, how they should be tested, when bioburden should be tested, what is the distance between the filters, when media fill should be done, what interventions. So many topics have been discussed already. I want to focus on the fact why we so much emphasizing the topics. an API is manufactured by chemical synthesis, then it's more or less logical. And we understand where the process starts, where it ends, and we also know that there are complex products, biotech products, monoclonal antibodies, vaccines, products like this. And here, I want to remind you that Chapter 2 in European GMP and in our GMP starts with paragraph 284, and it says that the manufacturer has to define the operation where the step starts. If the manufacturer has to identify the start, then the manufacturer has to identify what the API is for this manufacturer, as is. Why is this important? I will express the inspector's point of view. If we consider global companies which have many manufacturing operations executed at different manufacturing sites, not even in different countries, but in different regions of the world. And imagine how an inspector can trace the entire chain and trace the API through its chain. What are the requirements for storage, how it should be sterilized, whether it's pre-sterilized or is it ready to be sterilized, whether it's an intermediate product. It's not that easy, believe me. It's not as easy as it seems and simple as it seems, and the manufacturer knows the process on the whole. I can remember examples of inspecting 7 manufacturing sites in terms of one product. So you can imagine why we emphasize the importance of this topic so much. Once again, what is the starting point of documentation? Honestly, even in big pharma companies, it's not a frequent occasion that we see a documented evidence what the finished pharmaceutical substance means for the manufacturer. I'm sorry for this invented term, but this is the essence, this is the nature. What is my point? There are GMP requirements, but in the order we have a statement that it should not only be the substance manufactured according to GMP, but also according to local legal acts and regulatory acts. Here I want to reference the pharmacopoeia and tell you why this topic is sensitive. Why is this topic sensitive? We have paragraph 284, and it says that these guidelines do not apply to the sterilization processes and manufacturing of sterile pharmaceutical substances. And once again, we are referenced to Annex 1. Once again, at this conference, I heard a lot that our foreign colleagues also focus on this, and we expect revisions to European GMP in part of Annex 1. And we are aware that hot discussions are taking place in terms of single-use technologies and seeded technologies. We try to be in trend of all these novel novels. If we reference Annex 1, it says that filtration alone is not considered sufficient when it is possible to conduct sterilization in the final container. It's clear that a biotech product might not stand terminal sterilization, and some thermal treatment should be done for the product. The API may be contained in a buffer solution, and it's important for us to understand whether any studies on thermal treatment were done on the components of this solution. What is the equipment used for such treatment? So we performed this complex evaluation, and I once again emphasize, please understand that it's a very complex issue, and we want to be very well aware of all the nuances so that to conduct proper evaluation during an inspection. Just 1 second. Let's see the requirements of our pharmacopoeia. Sterile APIs for sterile products are not subjected to sterilization should be sterile, and B, those products where sterile filtration is used. The guideline says that it's not 100% assurance. I just want to tell you. Пропал звук. У меня нет звука. У меня? Не знаю, у меня шум-то есть, но у меня звука нет. У меня нет звука. У меня нет звука. У меня нет звука.
субстанции. И особенно важно понимать технологию готовой лекарственной формы и аспекты стабильности лекарственной формы и субстанции. Поэтому стерильность активных аллопатических субстанций это стерильностью, созданием качественного, эффективного, безопасного лекарственного средства и со стабильностью этого лекарственного средства. Поэтому такой показатель актуален для технологии большинства биологических препаратов, и это связано в первую очередь с тем, что молекула очень чувствительна к воздействию различных факторов, знаете, прекрасно понимаете, биологические молекулы, как таковых, присущи изменчивость. И стерильность гарантирует качественный процесс и то, что наш продукт, он будет соответствовать спецификации и будет безопасен для пациента. Поэтому с точки зрения производства скажу, что, конечно, тема обеспечения стерильности и поддержания характеристик, обеспечивающих стерильность субстанции, стерильность готовой лекарственной формы, она очень важна и зависит от очень многих факторов. Конечно, Вячеслав в своем докладе отразил регуляторные требования, и при работе с стерильными субстанциями для нас первостепенным является приложение органика режима. И в соответствии с регуляторными требованиями, с научным подходом к разработке субстанций, с требованиями ICH и учитывая современный подход к фармакопии, производитель организует производственный процесс по производству субстанций, последующему готовке лекарственной формы, таким образом, чтобы помещение, оборудование, персонал, производственные среды, все факторы, которые могут прямо или косвенно повлиять на качество и на показатель стерильности, они были обеспечены надлежащим образом. Производитель организовывает колоссальное количество мониторингов. Коллеги, которые работают со стерильными субстанциями, со стерильными лекарственными формами, в которых есть асептические процессы, понимают, о чем я говорю, какой-то объем мониторинга и огромное количество работы. И, соответственно, вся эта огромная деятельность и влияние на все факторы, которые могут отразиться на качестве продукта, они требуют регулярного
And they require regular assessment and regular exchange of the information to be the control and monitoring implemented.
стерильность, он изначально предопределен, мы его, как производитель, разрабатывая продукт, конечно, сам определяет,
We as manufacturer
субстанция должна приобрести
manufacture the
свойства стерильности,
product and the API should be sterile, and how we should organize our manufacturing, what cleanliness grades, and this is decided on a case-by-case basis, and it is important to focus on the molecules, on their properties, and we are talking about not only the sterility of the API, but also understanding of the technology creation of the robust technology. All the changes should be justified Any change in the manufacturing process should be justified because it may be critical and may impact many quality aspects of the product. A bioproduct may be temperature sensitive, that's why thermal sterilization might not be possible, and the manufacture of a finished dosage form under aseptic condition. If it's a liquid product, then media fill tests should be done, validation should be done, and we should confirm the conditions, providing the reliable information that that our product is safe and sterile for the patient. Considering the advanced technologies and the possibilities of technology implementation using single-use technologies, such technologies might allow reduced risks in manufacture of sterile products and in manufacture of sterile APIs. Thank you. You can have your cell phone. So, wonderful.
Здорово, спасибо большое.
Irina,
И
goodbye.
если можно, тогда уважаемый доктор Феринг Лукас, глава инспектората Министерства,
Ferenc Mukas, we will ask you to comment on the approaches of foreign regulators and manufacturers in terms of sterile API.
Thank you very much for the question. This morning we heard a lot about the APIs, API production and API inspection. I think the API inspection, this is a very, very complex, as we could see. The inspector should have a very deep scientific background to perform the inspection and a huge experience in the API production. We see a big part from the API production this morning was contamination. Those contamination can came out from the solvent itself, which is used. Solvent that is excessive use is that was contamination. Can came out from the ethanol. There are so many guidelines for the ethanol and so on. And came out a lot of contamination, impurities from the technology itself. This morning we didn't speak about the genotoxic impurities, which is a very, very hot topic nowadays in the pharma industry. Last year we started with the sartan. First sartan was the valsartan with clostridium impurities. Very low level, so it's very difficult for the laboratories itself to detect this kind of impurities when we speak about only a few ppm. So the genotoxic impurities run through all of the sartans. So many sartans was attached as well with this impurity. Nowadays we have another ranitidine. I don't know if you heard or not, but there is a big problem with the ranitidine. A very similar impurity. Impurities itself, because the API contains some quantity of the ranitidine, but it's very interesting because these impurities from ranitidine became produced in vivo as well. So in the body we can see. So it's very interesting, and we will see what will happen. My colleagues at home sitting on the phone now because there is a telephone conference between the EMEA and our also in Tesla. But there's a limit here. Very difficult the calculation, very sophisticated the calculation. For that it is estimated 0.3 ppm. So the level is very, very low. So it will be very good. I just wanted to add this. So it's very interesting discussion.
И переходим к нашему последнему вопросу.
And now, our last topic,
Требования регистрационного досье
compliance of the with the registration file upon an inspection. Vladimir, please. It's just because you are so shy.
So it's okay, we've adjusted it to fit my girl. Good evening. Oh, sorry. Good afternoon, dear colleagues. Okay. I will start my presentation that is called Compliance with the Requirements of the Registration Dossier as one of the key aspects of the assessment during GMP inspections. The first slide can be seen now, which shows the number of inconsistencies that are related to the registration to the pharmaceutical quality system, and you can see that more than half of them identified by our institute during inspections in 2018 related to foreign manufacturers account for inconsistencies with related to registration dossiers. The dossier. Most of the inconsistencies with the registration dossier include the following. First, a manufacturer analyzes their drugs inconsistent or out of conformity with the requirements in the registration dossiers. Also, storage conditions for drugs that don't meet the requirements of the registration dossier. And it's quite often, or sometimes, the content of the drug does not meet the requirements of the registration dossier registered in the Russian Federation. Also, those examples abound. It doesn't happen only, it's not only in India, but sometimes in Russia drugs are manufactured on sites that are not specified in the registration dossier. Also, something that occurs quite often is that the technological specifications of the volume of drug production and the batch number, series number do not meet the requirements specified in the registration dossier. This slide now is a reminder that a drug can be suspended in the Russian Federation by Federal Law 61, Article 65, which lays out paragraphs under which the use of a drug can be, or the application of a drug can be suspended in the Russian Federation. And pursuant to that law, number 61, if the content and the technology of a drug is not consistent with or is different from those shown in the registration dossier. The next paragraph is that a drug is manufactured at a site not specified in the registration dossier, and a manufacturer of a drug does not have documents confirming the compliance of the quality of the drug for human use and for medicinal purposes. And another important point, last but not least, is that within the period agreed with the Minister of Industry and Trade of Russia, a manufacturer does not eliminate violations of the requirements that were identified during the previous inspection, which could serve as grounds for suspending the application of a drug. Now I will show you two slides from the conference held in London in 2018. The MRHA regulator from Great Britain shows you this tendency or trend in that slide. This slide was drawn up by the MRHA regulator from Great Britain, and these tables show that all the comments are divided into GMP sections. The first one is the pharmaceutical quality system in 2016 and 2017. You can see that these deviations related to the pharmaceutical quality systems come first. The second is documentation. The third section is production. And the second table, however, shows you the points that were mostly commented upon by MRHA inspectors 1.8 is the first, 1.6 is the second section. Is the first section of GMP that has to do with pharmaceutical quality systems, or the pharmaceutical quality system. Another slide is an MRHA slide which shows you a trend, and it's from the first GMP section also, and most of the comments are related to the paragraph 1.4 pharmaceutical quality system, and 1.8, and much like in our case, it accounts for about 50%. Meaning that manufacturers need to manufacture drugs in accordance with the requirements specified in the registration dossier and the protocols of in accordance with the test protocols and product specifications. Fortunately, regulators check the dossiers during their inspections and demand that manufacturers produce their drugs in accordance with the requirements of registration in a given country. Thank you very much for your attention. Vladimir, could you go back to the slide where there are inconsistencies according to Article 65? This is something I would like to call the attention of all our colleagues to. The slide showing Article 65. Please go back to it. Please start the presentation again so we can navigate our way to the slide. Thank you. Last point, which says that manufacturers have to modify the grid kappa. It is not related to the only comments in the first 4 points, but to all comments which need to be rectified. If something is not rectified, at least one point, it could serve as grounds for suspension or for deliberations on suspension. Thank you very much. The last slide, I have a question, said thank you in all the languages where you have been, right? Thank you very much.
Vladimir, you took my paper as well. Seems like. You took my paper. Yes, I know you very well. You're always doing like this. Thank you. And now, I will ask Natalia to share your experience or to comment. You have vast experience, I believe. Hello, colleagues. I think that I'm the last one to speak, so I have this very important role to be brief, to be exciting, and to have this beautiful full stop at this conference and as a starting point for the future. I'm very proud of my company, of my team, and of myself that we are here, that we speak at the conference. I'm the second from my company to speak. And it's a pleasure for me to have a colleague from the Regulatory Authority of Hungary in the same panel, and I believe that it's a huge achievement for us. We are a Hungarian company. We have facilities all over the world, not only in Hungary, but in other countries of the Eastern Europe, Romania, Poland. And our facility was the first one to get the GMP, European GMP certificate, is located in Yegorivsk in Russia. We have a huge portfolio and we have a lot of statistics, and you know that the more products are, the higher is the risk of a mistake. So when we were first inspected by the Ministry of Industry and Trade, we had observations to the registration file, but there were not many. It was the very first evaluation of our activity. Historically, the registration file is understood differently. The Russian manufacturer and the foreign manufacturer sees the registration file in one way, while the Ministry of Industry and Trade sees the registration file under a different point of view. At the same time, the Ministry of Healthcare sees it in an absolutely different way. So when preparing for my comments, I wanted to emphasize the importance of understanding the vision of the other stakeholder. When we have observations during self-audit, when we have observations from regulatory authorities, not only of Russia, but of other countries and audits from our partners, what we say is that we are right as well. We have a pharmaceutical quality system, and maybe this observation is not worth it, but we have to take the position of the opponent, of our partner, and we have to discuss this point of view. So, in terms of the registration file which exists with us, you all know this well-known triangle. You are professionals, and I'm very proud of being in this environment of professionals. This is the platform for us to share the experience and ask questions and get answers. The structure of the registration file is as follows. The first block is administrative information. We have a lot of this, and it depends on the type of the product, whether it is a biotech product or a simple molecule. Then the second part is documentation on summary on clinical part of the dossier and chemical part of the dossier, and modules 4, 5 concerns clinical trials. The whole contents of the registration file is important, but in terms of observations during inspections, we focus much on administrative information because we have to align all permits, certificates, licenses with what we have registered. Then, when we work with Module 1, administrative information, we are to clearly understand what we want to register and what changes we introduce. Here I want to share our experience and say that many years ago we implemented electronic documentation system among all the facilities. So it's impossible that this or that facility will have a different version of the normative document. It's impossible. So it's very important, and a recommendation for those colleagues who have facilities in different locations will be to work in the same documentation system. We have very positive experience of that, and we can share this positive experience. Many people are involved in compiling the dossier, many are involved in maintaining its life cycle, and it's very important to explore all the changes. Of course, there are changes in the technology, in the composition, and the facility will be aware of them. And there are changes required by the regulator. When a regulator from Vietnam comes and makes an observation, now we clearly know that very soon we will get this change control, and we will have to introduce changes in the documentation of the Russian Federation. So yes, here we can share the experience, and we can tell you about our experience on that. Now, in terms of the normative document, on the first day of the conference we discussed the role of this document. It's important, obviously, but still we have this rewording. So let's say we have the initial document, it's module 3 of the registration file, and all the quality documents are available there. Yet we have one more document, normative document, and this is just an additional chance of having mistakes. This document may be giant. When we translate it into Russian, then we send it for expert evaluation, and then it comes under expert evaluation. So we might have some mistakes, some errors, some nuances difficult to be understood by the lab. And what do we inspect during the inspection? We are asked to provide the normative document. And this is the essence of our preparatory work. Maybe we should discuss something in this case, how to approach it. Now we are entering, and we are in the Eurasian Economic Union, and each country has its own requirements. We do not have one single document governing all the member states. But we are on the way, and manufacturers, regulators are moving towards this. What else is important? The registration file is submitted to the Ministry of Health, and we receive this document approved. What's next? Next, the manufacturing site works with this registration file. If we are in Russia, then we can see the electronic version of the document. But it is very important to notify every stakeholder, every party about the contents of the registration file. So when working with the registration file, we see the importance of bringing the knowledge of this registration file to all the involved. Let's say it's contract manufacturer, and our CMOs may be located in different positions, and the specifications may differ. When we ask them to revise, they're saying we have the same customer, we have the same registration file, we had the same inspectorate coming from the Republic of Belarus and from Russia, and now you come and ask us and you require us. We have questions. Maybe you're not professional. I believe that here we have to have cooperation among the controlling organizations and the companies. One of the most popular observations is the use of standards, reference standards. Our federal law is about to be put into effect, Law 425, and now not only manufacturers are responsible for releasing the market, but also distributors and partners are also responsible. And now we have a question. Testing. We have many laboratories in the country. In our portfolio, we have more than 150 registration files. I do not include strengths here and dosage forms. We have to provide monographs for testing, and here we need to secure how we can provide reference standards to laboratories. I can tell you the price of reference standards. It's 10 million rubles. Can you imagine? We are just preparing for November, when we'll start serialization. Then we'll have this in stock, of course. But you see the expenses. They are tremendous. Now we have a task to think over the use of reference standards by accredited laboratories inclusively. A very important part is storage of products. We have a challenge that when we have a large portfolio, we have more difficulties, but we still have more experience. Storage conditions differ in different countries. And within each project, we do not have the standardized approach to interpretation of stability studies. Thus, in every country, we have its own understanding. I do not know how my colleagues manage, but for us it's a challenge. We discuss it a lot with our manufacturing sites, whether we should store in the original packaging to protect from radiation, light, moisture, and whatsoever. And we go to other countries and they're saying, what is that? Why do you need these conditions of storage? But historically, we have the requirements like this. In the other country, we have requirements like that. So we need to revise the document so that to avoid major observations in terms of this during inspections. What else I would like to say? The importance of bilingual documentation is very important. You know that foreign sites have registration dossiers in their language. Here in the Russian market, we have dossiers in Russian, and it's important to keep up to date Russian documentation so that to have complete dossier approved by those countries where we are present. Thank you for attention. If you have any questions, you are welcome. Thank you very much. Seems like we are done with the session, and now we'll switch to answering the questions that were received from various sources. I will start with the questions asked yesterday on the website of the conference. Colleagues, you might correct me. Igor will help me. Thank you. So the first question was, how does the ideal scenario of the application with the explanatory note look like? What should we focus on when applying for an off-site inspection? And here we mean adding facilities and lines to the previously inspected scope. So here, as I see, you mean the expansion of the scope of products to be inspected. As you remember, according to the governmental decree, it is possible to expand the scope without an inspection at all. For that, you have to collect all the information that the products you want to add in list 3 covered by the inspection are manufactured at the same facilities using the same lines, and that the products are of the same therapeutic group and dosage form. So basically there are no changes, and there is no risk of incompatibility of our products. All the documents are submitted to the Ministry of Industry and Trade, and our colleagues there review the documents. In case your application has a positive conclusion, then you will have a new statement, but with a different expiry date. It will be calculated, the validity period will be calculated starting from the date of your last inspection. As for availability of the video of this masterclass, I know that the presentations will be uploaded to the website of the conference. The next question. Do on-site re-inspections are performed at all times? Can it be a documentary check? Seriously, I'm pissed at this question because I do not know what is a documentary inspection. I don't know what inspecting is. I know who inspector is. I do not know what is a document-based inspection. Inspection is an inspection. Sometimes, in certain cases, it is possible to have an off-site audit or inspection. We review the documents, but it's a very specific case, and you should understand that it is an inspection on the whole, and all the documents should be translated into Russian, and we might need to talk to your people to clarify certain issues, and they are to be provided for an interview in the by the due date, and you know that the inspection is held during 2-3 days, and the requirements for such an inspection are the same. And if you don't manage to provide documents, if you don't manage to provide people for an interview, and if we don't have documents to clarify this or that observation, then you will have an observation, a deficiency. So please, let's not call it a document-based inspection. We only have inspection, while the form of it may vary. Yeah, this is the question. If in sterile area the product is manufactured which does not require sterility, it's an intranasal product, and then during the inspection will you have the same requirements as for the sterile area? Of course, if you classify rooms as sterile, and we will inspect it as a sterile area even though you manufacture a non-sterile product there. Please clarify, do sites producing materials for clinical trials have to pass the inspection? Yes. By this time, according to Federal Law 61, Article 39, in this case, you apply a GMP certificate issued by a regulatory authority of the country where the product is manufactured. So in this case, you require a GMP certificate of the country where the samples for clinical trials are manufactured. Will the readiness of the manufacturer be evaluated, of the manufacturer for labeling system be evaluated during an inspection? We evaluate availability of the serialization system within the pharmaceutical quality system, so we will assess it within evaluation of the pharmaceutical quality system. The equipment has to be qualified, and as for packaging lies, we are going to evaluate qualification documents. So this is it. What do you mean? What do you mean, sorry? You are to be prepared for the process. You have to be a planned change then. Sorry, she doesn't have a mic. any planned change requires a plan of activities, so you can at least show us the plan of activities, an action plan towards this planned change.
Thank you very much. Since last 3 days, our brain is saturated with all global GMP trends, right? Here, because as a regulator, if I think, because ultimately we have to protect patient health, which means we have to provide and promote public health in the world. But as a regulator, because since last 20 years, if you can see, the revolutionary changes taking place with respect to various guidelines, okay? That we appreciate. Technology is going fast. Regulators should update our current science. This is number one. Number two, when we are yesterday, we had discussion, life cycle management, ICH, Q12, elemental analysis on starting materials and excipients, starting from our simple magnesium stearate, alginate, titanium dioxide, etc. 26 elements we have to take care. And today, one toxicologist and pharmacologist required with respect to GMP facilities to have the established limits with respect to toxic, low medium, highly risk, same medicinal product. So, how we can have the access and availability and affordability of quality medicines? Because as a patient, I'm thinking now. This is number one. Number two, across the globe, we are having various languages barriers. When we are talking about harmonization on GMP as a regulator, how we can harmonize? Why don't we harmonize our different languages across the world? This is also one of the challenges. Unless you have a standardized document with respect to the guidelines, it is very tough to understand and have the unified policy across the globe. These are the two my doubts I got. Since 72 hours we have been continuously discussing, morning 9 o'clock to evening 8 p.m. So excellent presentation. I want to congratulate the State Institute of Drugs and good practices, and definitely we have to keep good practices, but this is also one of the challenge, and I want to share my experience as a regulatory point of view. Thank you very much.
Thank you very much. And we support you, here. It's our understanding as well that working from 9 o'clock in the morning till 8 o'clock in the evening is very important for improving our GMP practices. If we change the vial sterilization machine, is this a change in the process, and how should we behave that when the machine is replaced after we apply for a GMP inspection? Igor, please help me here. It's difficult to answer such questions without knowing the context. Maybe someone will disclose the context. No disclosure of the context, just answer like this. If we are talking about the depyrogenation tunnel and it's similar to the one which was present in the line before, and if you assess all the risks that replacement will not impact the validation status of the manufacturer on the whole, then in this case we can review the qualification documents and do not have concern in terms of process validation. If certain parameters of this tunnel differ, then in this case the validation status of the process could be undermined, and maybe the process should be revalidated. Thank you very much, Igor. Upon inspections at the one site, it's contract manufacturer, and there might be different applicants. Different group of inspectors come, and Yes, we see that contract manufacture is the most difficult thing, and they are applied several times for small products, for large products. I'm sorry for saying that. If a group of inspectors comes to the facility with one applicant, with the other applicant, we sign agreements with confidentiality provisions. And of course, we know what is going on at this site, but we cannot disclose certain things either to the first applicant or to the second applicant. If the first group of inspectors comes and if you find certain observations, we expect the manufacturer to start working on the copper. Then a second group of inspectors comes, and if we see activities ongoing in terms of deficiency, then we are fine with that, because for us it's important to see that a manufacturer is striving for compliance with the GMP requirements. And if you have already started working with the deficiencies identified during the first inspection, then we will be satisfied with this approach. We discussed CAPA plans yesterday. There are long-term actions, and there are actions which require serious investment, but for us it's important to respond to the process. And if you have already initiated the work based on the CAPA for the previous inspection, then we are satisfied with that. This is done, this is done. What else did we have yesterday? We had a question in terms of the batch size for validation. We need a context for this question. Going with an inspection based on the application concerning new drug approval or revising the registration file due to a listing of an additional manufacturing site or any other changes. If it is a new drug product with which the company is applying to all markets, it means that for the time of, it's clear that for the time of the inspection, the company will ever hardly have 3 validation batches. According to ICHQ1, we expect to see at least validation of in the scope of 1/10 of the industrial batch. Even for this small scale, you need to have the full scope of documents. If we are going to the site which already manufactures the product for other market and is just introducing the drug to the Russian market specifically, then we expect to see full validation. 3 batches. Yes, full-scale batches according to the registration file. If your validation is based on the smaller batch size, then next time we will anyhow verify your full-scale validation.
In Annex 15 it says validations on 3 subsequent series, and it has to be successful, the validation. Our colleagues pointed out yesterday, validation cannot be even accepted by you. How do you determine the number of deviations which allows for a positive conclusion statement in the report and the final observation by whom is established? So inspections are performed by inspectors. Foreign sites are inspected by authorized subdivisions of authorized organizations by the Ministry of Industry and Trade. It's our institute that's been authorized by the Ministry of Industry and Trade. Within our institute, we have that special subdivision, the inspectorate subdivision that inspects foreign sites. Based on the results of inspections, a report is issued for whom the inspector is responsible with two signature or three signature depending on the group of inspectors, and the head of the inspecting group has to be an inspector, and everything that in the inspection report says is the responsibility of the inspection group, not me, not the group, a group of experts which works with inspection reports and where it's maybe our head, direct head, but if they go out on a visit and put a signature, so two or three persons who make up that report based on their opinion whether your production practices comply with the GMP requirements or not. Two signatures by inspectors and their conclusion. This is what it looks like. When the report goes to the Ministry of Industry and Trade, the decision whether to issue a statement is made by the Ministry of Industry and Trade. Am I right in what I said? Yes.
What other questions do you have? Thank you very much for this opportunity to ask a question. I would like to ask a question to Tatiana. Tatiana, in your presentation, you talked about very important topics for the industry in terms of cleaning validation, for defining the criteria for APIs for which the toxicological data and safety data on cumulative toxicity is not yet available. And Tatiana mentioned that it's good to use the APIC guidance for that. But I have a different question. Based on our firm's experience, how do you behave when after recalculating of carryover, and when you have these calculations based on permitted daily exposure, if you get the limit which is less stringent, which is higher when it was whether it could be calculated with classical traditional approaches, what criteria do you adopt? Thank you for this question, Vladimir. It's a very provocative question. We buy an additional line to separate manufacturer. You've been to our facility and you are well aware of that. The more stringent requirements are the basis for us.
Good afternoon. My question will be in English. My comments will be addressed to the Indian drug regulatory. I have a big, also quite big experience in the Indian manufacturing audit and inspection in my past. And the comments was from regulatory that the industry will not apply all this new norm. This is a protectionism, protection of the industry. But the regulatory cannot protect the industry, because after you don't protect the industry, the people will die. It will end like this. So So this is my comments and my proposal to the Indian drug regulator. Thank you very much.
Yes, I have a question. In the presentation, I had mentioning of the manufacturing license and the presence of products in the list. In different countries, we have different requirements to the form of the manufacturing license. In some countries, for instance, in Romania, there is a list of drugs to be manufactured by the manufacturing site. At the same time, besides, the first thing asked by the inspector at the inspection is the valid manufacturing license and a valid GMP certificate to align all the data. In case with Romania, there is the main license listing products in routine manufacture, and those products which are applied as a project, they are listed separately. They are in Annex 13 and they are listed there. So when we go for expansion of the list or when we go for the next inspection, then we have validation of 3 batches, we have qualified equipment and all the conditions for manufacture, and here we would also have the requirement for listing this product in the document, because otherwise we will not get the Russian GMP certificate to be filed to the Ministry of Health. So here we meant foreign manufacturing sites.
Stefan Oettinger from Amgen. I want to come back to the re-inspection procedure, and I fully agree and see your arguments why you want to come back again. The point is, some other agency do the same and come back again, but they come back again with the same inspectors and just look at the deficiencies and how the CAPAs have been fulfilled. The feedback we get from the European Industry Association is that in Russia it's so that different inspectors come and perform a complete new inspections for 3 or 4 days and may only focus on 1 or 2 hours on the CAPAs from the previous inspection, which caused the re-inspection. My question is there an opportunity to consider that potentially the same inspectors go there or the re-inspection only focus on really the issues which the company had, and using the PICS approach of risk-based inspection, this would reduce the inspection time from 4 days to 1 day, and you would get the inspector the information you need. Any thoughts on that?
Let's try to answer. Let's go back to re-inspection process. Indeed, now we have several types of re-inspections. The first type of re-inspection, which is most important for us, it is when the first GMP compliance statement expires. It's clear that from the time of the first inspection 3 years have passed, and if we are focusing on the risk-based approach, then if a manufacturer was inspected 3 years ago, to have a full picture and to implement the risk-based approach for each site, we would have to gain certain statistics and have inspections, full-scale inspections of this site 2, 3, 4 times, because we cannot talk about a risk-based approach. A second type of GMP inspection is re-inspection in case of a refusal to issue a GMP compliance statement. I'm sorry, but having a refusal, if we apply a risk-based approach, refusal means that you have more than 20 major non-conformities. Then our risk-based approach tells us that we have to re-inspect on the full scale, And you are right saying that, of course, inspectors present at the first inspection should be involved in the group of inspectors present at the second inspection. And we try to follow this approach now. And a part of a reinspection is checking CAPA. And it's important for the person who was present at the first inspection to go through the CAPA of the previous inspection. You know that our inspection reports after a refusal has description of all the actions taken by the company towards each deficiency, including critical and major non-conformities. During inspections, our colleagues still find new observations, but yes, it is an inspection, and a part of the inspection is working on CAPA, but we also have to perform the inspection according to the plan we provide you with. A risk-based approach requires some time once again. It is impossible to evaluate the company fully only after one inspection. We'll gain more experience, we'll gain more statistics, and this is where we will apply the risk-based approach. Please. Comment is great, but if you don't mind, we want to answer the questions because the next flight is in 2 hours. I'm sorry.
So I appreciate your point. I fully agree with you. So this is the global problem. So repetition of inspection, one company facing every month, every 15 days there is audit. So until and unless we become the ICH full membership, like EU, Japan, Australia, then slowly we can have one single window inspection, we can have assurance of the quality medicine. This is number one. Number two, madam, in India, we are having more number of units. I agree with our Russian State Institute of Drugs. We are having.
I am not from regulatory now. I'm not from regulatory.
Okay, okay.
Just my experience with
Colleagues, sorry, I'm really sorry. Really sorry.
So good. He's from the trade. He's from the manufacturing.
I'm really sorry. Let's have a separate discussion with the Indian regulator if possible. We have many interesting topics to discuss, but let's have a separate discussion with Indian regulators because there are so many questions.
When technology is increasing, then cost is increasing. So how we can increase? Because they are all going by step lot of guidelines and cost is increasing.
Thank you very much.
Colleagues, let's focus on the questions. Hello. My name is Maxim from Mais Consult. You are talking about publishing critical. You already know the question. Okay, so I will not continue. Yes, your question concerns the possibility to publish the critical observations of inspections. Once again, the format of having inspections is based on the application. In every agreement on inspection, we have confidentiality provisions. The information about refusals to issue GMP compliance statements is published on the website of the Ministry of Industry and Trade. On our side, we can only discuss non-conformities detected with a specific manufacturer if this manufacturer wants it. We cannot and will not publish reports. We have no such powers. Hello, my name is Anna from Verop Pharma. My question is about inspections within EAU. In European Union, we have dosage form specific inspections. Will there any mechanism to recognize the GMP certificates for the same dosage form? We as manufacturers have the same contract manufacturers. Can we share the GMP certificate for a certain dosage form? Obviously, you can share them already now. The most difficult situation is with contract manufacturers. You companies, pharmaceutical companies, on your own, and maybe it is better for this contract manufacturer to initiate an inspection, and then this manufacturing site can share the GMP certificate to any of its customers. It's not our pain on how you can share this GMP certificate. Oi, Olga, you still have questions? I just sit for a long time here, a bit bored. Everyone obtained certificates, 3 years passed, and let's say the manufacturer is not in a hurry to confirm the certificate. Everything is registered, there's nothing to register, but actually the manufacturer will not have a valid GMP certificate. It means that this manufacturer will not comply with GMP. How should we treat this situation? But why do you need that? I'm not talking about myself. It's not my company. We reapply for GMP certificate, but I think that people are afraid, those people sitting in the first row. So I might be mistaken, but in Europe, if there is no GMP certificate, then circulation is terminated. I might be mistaken, but how it is according to Resolution 777? What can I say here? I will ask Elena to help. So you are asking of what? To provide you certain sanctions? We can think over the sanctions. Who is afraid? Who is afraid? What do you mean by afraid? You shouldn't be afraid of any inspection. Inspection is a perfect chance to see where you're wrong and to improve. If you have any suggestions on how to treat those who have an expired GMP certificate, then we will be glad to see the suggestions, proposals. Yes, and probably the last question. Can we have a mic, please?
Скажите, пожалуйста, вот это постановление о приостановлении, да, обращения к лекарственным средствам, на какой срок выдается такое приостановление?
Sorry, no mic. This question is not to us. This is the question to the Ministry of Health, because we are sending the information and the Ministry of Health makes a decision on suspension. When we worked on that topic with the Ministry of Health, we were saying that when a company confirms its compliance, so we send them the results again and they stop suspension. My name is Igor. Upon a re-inspection of a contract manufacturer, if we apply for a re-inspection and we have this dosage form and this manufacturer was inspected for other dosage forms, and will you, during a re-inspection, will you check COPPA for other dosage forms? You don't read legislation correctly. We do not have a notion of re-inspection. If we have a contract manufacturer and it has 5, 10 customers, let's say, and many dosage forms, tablets, sprays. Let's say we first inspected tablets. Doesn't matter whether there were observations or not. Then you come with a spray. We will focus on sprays, and it will not be a re-inspection of a contract manufacturer. The applicant is different, the products are different, normative documentation is different, and manufacture in this case will be different. Please read regulatory documents carefully. We have only inspections. There is no definition of a re-inspection. Am I right to understand that you will consider kappa only in terms of the dosage form applied? So if previously there were observations on spray and we apply for tablets, then you will not focus on the kappa for sprays. You are right. Is it an overall question to the quality management system? If you work on your quality system, we can see it in your documentation. Usually you provide the outcomes of previous inspections, and in the good company, it all can be seen in the changes implemented. But if the changes were implemented based on the outcomes of other inspections, then we will see it in your change control system, but we will not focus on them during the other inspection. 10 more minutes, and please, I will let you go because we have flights. As for the EAU, when can we expect applying for GNP inspections according to the EAU's requirements? It's clear that the regulatory documents are not yet available, but as for the timelines, it's a very important question. We had a session on the EAU, and everything what was said here is that the regulatory database is not yet available. Yes, it's not available. We do not have qualified persons certified according to the union's requirements. The rules are the same for everyone here, and when we adopt the union's GMPs, we will require availability of the qualified person complying with the requirements with the resolution 73. Do you all have such qualified persons? We have 1 year to have them. If we have no other questions, then in this happy moment, I want to say goodbye, and we'll see you at home. Goodbye.